Okay, good afternoon, everyone from Philadelphia, Pennsylvania, and thank you for joining us today. We're thrilled to welcome some new faces and some familiar faces to our panel discussion, Transforming Healthcare. My name is Chris Miller, and I lead our marketing department here at IT Solutions. Catherine Human, our marketing specialist, is also here today to help me moderate our panel discussion and ensure that your questions are answered. We're going to get started here with how IT Solutions partners with organizations like yours, share some trends with what we're seeing with our clients, and then dive right into today's panel with our three guests. At IT Solutions, we're a managed IT service provider with 29 years of experience partnering with small, medium, and mid-market organizations across the nation. What does that mean? We are your one-stop shop for comprehensive IT services, and we are a trusted strategic advisor for over 470 clients nationwide, including 75 healthcare, life science, and pharmaceutical organizations. Whether our clients rely on us for cybersecurity, strategic guidance, or compliance support, we help streamline and fortify your technology so you can focus on a thriving organization and worry less about some of the day-to-day upkeep of IT. So what truly makes us different from other IT providers? At IT Solutions, we have 4 pillars that are the foundation of every client journey. Succeeding together. Through proactive communication and fostering trust, we work hand in hand with you and complement your in-house team and initiatives so you can achieve your objectives. Every day, we're focused on elevating your success. Tailored support. We redefine support to be uniquely yours. IT Solutions understands that your goals, markets, and current IT investments are unique to you. So we pair you with a group of expert consultants and engineers who are versed in exactly what you do. With a dedicated IT Solutions expert at your side and oversight of your infrastructure and security posture at your fingertips through our client portal, you'll experience prompt and personalized support. Whether you're interested in fully managed support or want to go the co-managed route and delegate certain tasks to us, we are here for you. Prioritizing your security. Security is at the heart of everything we do, and we work with you to implement this from the ground up. From cybersecurity training for all of your staff, all the way up to 24/7 monitoring comprised of managed detection and response technology alongside our cybersecurity specialists. Strategic guidance. To extend our partnership, IT Solutions clients are paired with a dedicated virtual chief information officer who will advocate for you, get to know the ins and outs of your business, and holistically safeguard your interests throughout your entire technology journey. This level of holistic support and a long-term partnership allow us to dig deeper into your challenges, find the root cause, and provide tailored support for your specific needs and concerns. We're not a vendor, we're your strategic partner and an advocate. So I wanted to share some of the challenges we're seeing alongside our clients and their vendors and partners. We know your goals are evolving quickly, and we think some of these topics may resonate with you. So with data fragmentation, having that across systems can hinder patient care, increase some inefficiencies getting to that data, and result in a lack of interoperability, data silos, and just takes longer to get through the medical history in a timely and secure manner. Vendor risk management provides additional challenges. Sometimes cybercriminals can exploit weaknesses more easily with your vendors than they can within your own systems. For instance, hundreds of healthcare organizations were affected by a ransomware attack on PFC Financial Company, which is an accounts receivable management firm. Telemedicine has expanded rapidly, but regulations vary by jurisdiction. You face complex legal requirements providing virtual care, and with the rapid scale that was required and that you experienced in 2020, it cut down on the time and resources you had to first implement it alongside a long-term vision and strategy. Another challenge is cyber attacks. No one wants to experience a cyber attack, especially when patient care is a factor. Today, with more and more IoT devices like IV pumps, a cyber attack can unfortunately stop your team in their tracks. Certain third-party agreements like cyber liability insurance can be challenging and hard to understand just from a first glance. With our clients, we've seen that if they don't have the proper guidance or invest time into this, there can be a disconnect between how a policy relates to their actual infrastructure and risk management goals. Another common challenge we're seeing from similar organizations is understanding regulations, having the appropriate support, personnel, and resources in place, and then streamlining those tools and policies to ensure that you can provide and maintain compliance. As I noted, cyber attacks are a pervasive threat and one of the most common concerns, especially with the growing intersection between technology and patient care. Whether a cyber attack causes downtime of electronic records or a halt in medication dispensing systems, it's extremely disruptive to staff and patient care. This chart from the Ponemon Institute highlights some of the immediate adverse effects on patients, like longer inpatient stays. So whether you're a provider or you're a business associate like IT Solutions, the ultimate goal is to fortify your IT infrastructure, ensuring your data is protected, accessible, and that your day-to-day remains uninterrupted. So now I'm excited to welcome our three panelists who are here to pull from their experiences and expertise to answer your questions and provide you with some actionable takeaways. Chris, Joe, and Andrew, thank you for joining us today. Before we dive into some questions from the audience, could you please share a little bit more about yourself and what you have in store for us today?
Thank you, Chris. Yes, my name is Chris Conradi. I am an insurance broker and risk consultant. Our firm is physically located in Kansas, but we are licensed in all 50 states. I personally have 15 years experience helping healthcare organizations manage risk and secure the correct insurance solutions that are candidly the last line of defense when the risk management plan does not materialize as hoped for. We do work with over 200 healthcare facilities. I would say one of the things that's unique about what we do and makes what we do kind of complex is the unique regulatory landscape from state to state. Insurance as a business is overseen and regulated by state insurance departments. And although some of what we're talking about today certainly has, federal law implications, the insurance products that are designed to help mitigate those exposures are regulated state to state. So I have to be careful about what state I'm working in on any given day. And if there's something that we're seeing that is interesting, it's that the rapid growth in telehealth presents multiple risk issues, ranging, of course, from cybersecurity. You've got people working remotely. That's a real thing when it comes to data management and network security. But also, things like state-specific employment law. If you found yourself with employees scattered around the country, whether it be work comp or other state-specific statutory drivers when it comes to insurance, you want to make sure that somebody's helping you with all of that. And then, of course, if someone's rendering care from one state to a person residing in another state, things like medical malpractice, jurisdiction identification have become an interesting thing as well for us. So thanks for having me today, Chris.
Yep, thank you for joining us. Okay. So Joe is also here with us today. He is having some issues with the audio, so we're going to move on to Andrew right now.
Hi, my name's Andrew Klusaritz. I'm the Director of Security for IT Solutions. I'm based out of the Philadelphia region. I've been doing IT since the HIPAA law was signed into effect in 1996. I've been doing cybersecurity for, over 22 years at this point. And I've been in various CISO roles at different firms, for the last 13 years or so. My expertise, my experience is primarily in pharmaceutical and life sciences area. And I kind of focus on blending bridging the gap between IT and compliance, in this case, from a regulatory perspective, HIPAA and other frameworks.
Okay, thank you, Andrew. Let's check in on Joe. Looks like he's still having issues with the audio. Let's see. So while Joe is getting, let me go back to Joe's slide. So while we're working that out, Joe has 28 years of experience in the healthcare environment. So in ambulatory clinics, hospitals, other healthcare environments. He's held a lot of different roles ranging from hospital revenue cycle to ambulatory clinics, working more on the patient side before moving into IT. Currently, he is the virtual chief information officer at Umbrella Managed Systems, and he has a unique perspective on both positive and negative impacts of technology on care providers and their support staff. Okay. So with that top of mind, we are going to open the floor to you in the audience. So we encourage you to ask questions and participate in our discussion as we have this limited opportunity with Chris, Joe, and Andrew. So feel free to enter your questions in our Q&A box or use the raise your hand feature so you can unmute and directly ask your panelists the questions. We've also added these instructions into the chat. So we'll give you a few minutes. Feel free to put those questions in the Q&A box or raise your hand. Okay, to get us started, it looks like we have our first question. How can we, healthcare providers, effectively assess our cybersecurity posture and overall risk before we enter new contracts?
I'll take that one. Third-party risk is becoming a ever more prominent part of just operations in every industry, but it's especially true in the healthcare and life sciences space. There's very few healthcare operations that are kind of standalone. You always require third parties. You almost always require vendors to help support your infrastructure, your operations, supply chain, et cetera. So, and they can introduce a lot of risk to the organization. So making sure that you have trusted partners to work with, mature partners to work with, is a big part of that. When we're working with firms, a lot of our firms are smaller organizations that can't afford to have like a full-time compliance or third-party risk management team or process even. And so we encourage them to rely on other artifacts sometimes, such as SOC reports, a SOC type 2 report that might talk about a particular partner's controls and how they're complying with them and how they're testing for them on a regular basis. That can go probably 90% of the way to getting you to being able to trust that this partner is going to, have mature processes, going to have mature processes around things like security and supply chain and, staffing and hiring practices, onboarding, offboarding practices. So I think that's the right place to start.
Yeah, that's some great insights. Chris, Joe, do you want to add to that?
Yeah, Chris, I might mention a few thoughts from an insurance perspective. As I touched on earlier in our introductions, the insurance policy is what you pull out when all else has failed. We are the last line of defense, and if somebody has made it around your multi-factor authentication or somehow circumvented your endpoint detection and response systems, and now you've had a data breach or somehow been debilitated by a cyber or network attack, that's kind of when we finally get called into the situation. When we see large claims, oftentimes there are two characteristics that have previously presented themselves, maybe from a risk profile perspective, I would say. One is a lot of PHI, a lot of unique patient records, and the other is a significant revenue source in your organization that can be lost, such as inpatient exposure or emergency department activities. If you've been impacted by a significant cyber claim and have either one of those characteristics, I would say it certainly elevates your risk profile, and that you should take your organization's cybersecurity more seriously. So again, a significant number of PHI, tens of thousands, if not hundreds of thousands of unique patient records. It just really ups the post-breach compliance costs that you will have. And then if you are an organization with significant revenues, it can impact your business income loss. And those are the two risk profile data points that I would ask many of my clients to focus on.
Thank you, Chris. There's a lot of different layers to the cybersecurity posture, and sometimes we think about cybersecurity tools, but liability insurance is another component of keeping a robust cybersecurity posture and staying protected. It looks like we do have a question from Brandon Holly, directed at Chris and Joe. So Chris, what are the most common cybersecurity claims you see? Joe, what can we do to prevent them?
Brandon, in the healthcare space, I would say that the most common cyber insurance claim that we see is data breach, whether that's instigated by a threat actor or an unforced error. We still see both of those in today's environment. Going through the forensic process of identifying which data has been exposed and then notifying everyone that's been impacted as a result of that breach is probably the most common cyber claim even today. Related to that, you might have a ransom payment component to your cyber claim, and you may also have, like we touched on earlier, a business income loss. And a quality cyber insurance policy will cover all of those things that I've just mentioned. Aside from a just good old-fashioned data breach, the claim that we see with some degree of frequency is also financial losses due to phishing or social engineering. So unfortunately, we do still see people falling victim to the direct deposit payroll scam, or someone posturing or posing as a C-suite executive telling someone else to make a payment and it's an emergency, and no, I can't take a phone call right now. We do see a handful of those every year, and I am kind of surprised that we still do, actually. It does seem like we kind of know what to do to avoid those, but they do continue to present themselves. So in that order, Brandon, I would say data breaches and then phishing losses. Yep.
Chris, can you hear me now, by the way?
Yep, thank you.
Very good,
Yep.
thanks. Yeah, sorry for the earlier audio trouble. Thanks for the introduction. I appreciate that. So talk about prevention. That was the second part of the question. So one, have to be doing the basics, right? So email protection, URL and attachment protection, multi-factor authentication on your remote access and email. This is going to stop a well-deployed multi-factor authentication system is going to prevent 90% of or more of breaches that start by email. And as I think most of us know, and probably most of our participants know, most data breaches of all types start through email in some fashion or another. Full disk encryption, endpoint detection and response software, what we formerly would call that antivirus software, static antivirus software, firewall with next gen sort of tools, and licensing. Backups are of critical importance. On-site and off-site, immutable, which means unable to be changed or revised in any way, even by an administrator. Your backup systems need to be in that sort of condition, and off domain, so that a compromised domain administrator credential can't affect your backups. And then your biggest liability is your staff. Phishing awareness, security awareness training of your employees is now IT Security 101. It's critical.
Yeah, great question, great answers. So building off of, the cyber liability claims, and just a policy in general. Policies often come with some exclusions or conditions. Are there any recommendations on what aspects you should carefully review or negotiate when going through this policy?
Sounds like that question is best directed to me, Chris, since I'm the insurance broker on the panel here. Yeah, I think so. I think when you're in a healthcare setting, this is not an insurance line that you phone in or check a box, have your medical malpractice insurance broker say, yeah, I've got you covered. I think you want to intimately understand what it is that you have for coverage. And I would say that the placement of the cyber insurance has as much gravity related to it as the medical malpractice insurance, as the property insurance if you're insuring a significant building. A quality cyber insurance policy will have an 8 or 10 part insuring agreement. First party compliance costs are something that you need to be identifying in your policy and know what type of limit you have. And it needs to have been thoughtfully identified related to the amount of records that you maintain. That is probably the most closely associated relationship between the limit you should carry and the exposure that you have is the number of records that you maintain. Cyber policies have good old-fashioned third-party liability insurance in them as well. So if someone says that your own negligence has contributed to the event and now their incurred losses, you want to be able to have a policy that defends you from a lawsuit or a liability allegation. So that's important. Then we're looking at things like, we see many policies that significantly sublimit the amount of ransom payment that can be made. It would be my preference that you do not pick a policy that's got a significant limitation on the amount of ransom that can be paid to buy back the encryption key or whatever other way that you're confirming these people have left you alone. Business interruption coverage for those with an inpatient exposure or emergency department exposure or doing procedural work that can't be rescheduled. You need to have a large business income limit of insurance. I think a lot of healthcare administrators pore over their financial data when it comes to selecting the right business income limit that they would need following a fire or a tornado or a water main break or something that's covered by the policy, property policy. You should be putting as much thoughtful contemplation in your cyber business interruption limit as you are your property insurance business interruption limit. And then, we see other coverages like regulatory fines and penalties. We see some carriers stemming those off, not wanting to offer the full aggregate limit for those things. When you've purchased your cyber insurance correctly, if there is a big theme, it's that you have very few sublimits. And that is what the carriers will try to give you if you don't ask a lot of questions. They'll maybe give you $1 million first and third party limit, but now your ransom payment limit is $100,000 or $200,000, and your phishing indemnification limit is much smaller. And maybe you have no bricking coverage at all because they don't really want to replace your hardware. So those are the types of things that I counsel our clients to look for and that we help secure insurance that has very few sub-limits to the overall insuring agreements.
I would throw one more insurance tip in there. I work with a lot of our customers on a fairly regular basis to complete questionnaires for cybersecurity policy, either underwriting initial or renewals. And the one thing I always counsel all of our customers to do is you have to be honest on the questionnaires. So they're going to ask you, 20, 30, 40, 50 questions about controls that they'd like to see you have in place. And you need to answer them as honestly as possible. So I'll give you one example I just saw recently. They're always going to ask you, do you have multi-factor authentication on all of your remote access? And the customer I was working with, they had MFA on their VPN and on their email, but not on their remote desktops yet because of various reasons. And they said, oh, well, I could say yes to that, most of it. And I'm like, no, you can't say yes to that. They're asking you all of it. You don't want to give the underwriter some reason to deny a claim. You don't want to try and save whatever, $900, $1,000 on your annual premiums only to lose it because your $200,000 claim got denied 2 years from now. Be upfront, honest about what controls you have in place. They're not going to deny you insurance. You just might pay incrementally a little bit more because of your increased risk posture, and we'll work with you to close those gaps. So in the example that I just gave, the customer that we were working with, we had a project in place that was supposed to start in like 2 months to get them MFA on their remote desktop, but it wasn't in place yet. And I said, we can update the insurer, we can update the carrier once that happens, but at this point, you can't really say that honestly. There's a problem,
Andrew,
your claim could be denied.
I really appreciate you saying that. A cyber insurance application actually has warranty statements in it. And I think that, and you are saying everything correctly. If you answer questions incorrectly or inadvertently untruthfully, maybe you didn't even mean to answer them untruthfully, it can jeopardize coverage at your time of loss. That these warranty statements essentially can negate coverage later on. So there is no value in answering a question optimistically, like we intend to have that control, so let's just go ahead and say yes. The only right answer is the truthful answer, because you would hate to have spent $10,000 or $20,000 on this policy, and then when you need it, it can be easily documented that you answered a question incorrectly relative to the controls you had when you completed the app, because that's all very identifiable, right? I mean, they can see when you put those controls in place.
Hey, Chris, I have a question along that lines. Is it true that an insurer, in a scenario like that, so you've answered honestly, but you have an in-flight project, we actually are working on that right now, that they'll give you a grace period of time. They'll price your premium at a level where it includes that you have that technology or that protection, and then you have to provide proof of that by a certain date. Have you seen that?
Yes, I definitely have, Joe.
Okay.
And that's all about communication. That's all about having a good CIO or VCIO serving you, and then being able to communicate accurately to your insurance broker so they can communicate to the insurance carrier underwriter. And it is possible to get those grace periods, those dispensations, that 90 days to implementation, and then you send later the proof that that has been implemented, and that is definitely possible. But again, it's all about knowledge and communication.
Right, because sometimes that can be a wash, right? If you got, a potential $1,000 savings on your premium annually, and this is a $1,500 project, to be completed, it makes a lot of sense to get that done up front,
sure.
So that you can answer that in a positive way. Yep,
that's right.
Thank you all for sharing. I think there's some great takeaways from that. So, it's worth investing time in reviewing the conditions, and honesty is the best policy, because otherwise you're going to mitigate your coverage. So thank you. And it looks like we do have 3 more questions from the audience that we would love to get to. So let me start with Javier. I think there's 3 parts of this question. So the question is, when a data breach occurs, what are the necessary steps? What is the most effective timeline for taking action? And how do these factors affect your claims?
Yeah, I'll take that one because I've participated in far too many of these in my career, long before I got to ITS as well. So in terms of first steps, the first step happens before the breach. So you need to achieve some level of preparedness for the breach. And actually I don't want to sound like an insurance salesman, but actually going through and acquiring cyber insurance forces you to go through some of these steps. So it forces you to identify, particular contacts. It forces you to think about who you have to call when you have an incident and you have to notify. Who do you have to notify first? Should I notify the insurance provider? Should I, when do I have to file a claim? What's my window for all that? So just going through that process by necessity forces you to do some of the preparation. So, and some of those preparations would be, okay, like I've just realized that something bad is happening. What's the first call that I make? What's the second call that I make? What's the third call that I make? And really, once the breach is identified and, you're doing an initial triage. So every day we have alerts that come in and, and this happens in every IT organization where it's an alert, it's a suspicious activity of some sort. Is it a breach? So doing that initial triage and being able to do that quickly and accurately is, a skill set that most organizations have that IT Solutions helps try to provide to our customers. So looking at those alerts and trying to weed out, oh, this is just noise. This is not something we need to worry about versus maybe we need to dig into it a little bit more, or flashing red lights. Yes, this is probably bad. Yep, we verified it's bad. Let's get the customer on the phone right away. So when that happens, when we've identified an incident, the first thing we want to do is, and I used the word triage before, and I think it's appropriate for the healthcare audience maybe, but you really want to stop the bleeding at that point. So you want to stabilize the incident, just like you might stabilize a patient. You want to, try to, as best as you can in the heat of the moment, identify the scope of the machine's devices that were affected and the accounts that were affected, the users that were affected. So, we have, when we deploy our security as a service tool set to your organization, we have capabilities such as EDR, which is an endpoint detection and response capability that allows us to basically quarantine in real time an infected or suspected infected device. So if I got an alert that Chris Miller's machine was infected right now, I would have my team quarantine it. We could do it, within a minute. Chris would get knocked off of his conference call, unfortunately, but his machine, which is infected, would no longer be able to communicate with anything else on our network. So we would hopefully, try and contain that incident. Similarly, it's not always just a machine getting infected. A lot of times, maybe most of the time nowadays, it's an account that's being compromised. So if I saw that Chris's account, I'm sorry to pick on Chris, if Chris's account was, showed him having been logged in here on this conference call, and then also he just signed in from Bangalore, India, well, that's probably not possible. So we need to probably look at Chris's account, maybe deactivate him temporarily until we can figure out what's going on and how he was able to successfully log in from India when he's on this conference call right now in the United States. So, trying to quickly identify what is impacted, whether it's users, whether it's machines, whether it's particular software, or a third party vendor that might have propagated their incident into your environment. Being able to identify that quickly is key, and taking action to limit your exposure or remove your exposure to that source, as quickly as possible, really helps to get the incident contained to the extent possible as quickly as possible. That's not always possible. Sometimes adversaries are very sneaky, and you don't figure out that it's a real attack until they're already got their fingers in other systems, other accounts. But if you have the right kinds of visibility into an environment, you're monitoring it 24/7, you're able to see some of these clues, you have a very good chance of, trying to disrupt the attack before it becomes something, from a bad day to a catastrophic type day that's going to shut down your business.
Hey, Andrew, that was helpful. Very thorough. I don't know, Chris.
Yeah, I was going to ask Chris, I'll jump off of what Andrew said there, you know, from a technical perspective, but at what point do we contact the cyber liability insurer, and do most policies have a forensics and response coverage as well?
Yeah. The policy language, Joe, almost universally says immediately. So, and there's probably some jurisdictions that have case law that will help you understand what immediately means. But I think we all sort of understand, you know, that means right now without delay. They want to be, if you want their $1 million or $2 million or $5 million of coverage to be available, they want to get involved as early as possible. And yes, a quality cyber insurance policy will have initial sort of intake assessment and then immediately to forensics. Yeah, and the firms will be identified by the carrier who they have kind of pre-contracted with to do their forensics. So it could be that this is another place where the insurance broker and the managed services provider need to work together, because it might be that the MSP is like, I would really prefer that you have a cyber insurer that's going to use this firm, not this firm. Well, then I can go to market and help make sure that those priorities are met. Yep.
Thank you. I think the takeaway, it's always as quickly as possible. And there are a lot of parts to it in quarterbacking that response. So if, you know, you're looking for help figuring out what those steps look like for you, your incident response, can always rely on a partner to help make sure you're prepared in case something does happen. So we do have another question here from John. How can healthcare organizations effectively leverage IT strategy to drive meaningful transformation, enhance the quality, accessibility, and efficiency of healthcare services while ensuring data security and patient privacy?
So that's a very broad question, or wide ranging. So I would say that from my perspective, globally within an organization, the most important way to achieve all of those things is whenever any decision is being made, include IT, right? Even if leaders in other departments, senior leaders in other departments think, well, this isn't technology related, but there may be a technology solution to the issue that you're trying to solve. And being inclusive of IT and the technology division of your organization helps to drive all of those things. So even if technology ends up not being the central component of a solution, it can add efficiencies and lower costs, help drive revenue.
So I think we're going to move on to our next question. We have 2 left, and I want to make sure we get those answered. So Pedro is asking, with the increasing use of telemedicine and remote patient monitoring, what are the key cybersecurity considerations for safeguarding patient data and privacy?
Yeah, I think this really comes down to your third-party risk management, your vendor risk management process. And I know that sounds absurd to say for like a doctor's office of like 2 doctors, right? Like you're not going to have a third-party risk team, but you need to, pay attention when you're selecting the vendors that you're going to use for things like telehealth, telemedicine, to ensure that they're going to have the right kinds of processes and controls in place to protect your patient information and your uptime on that solution as much as possible. And I think that's something where IT solutions doesn't really generally support third-party or cloud solutions like that, but we can definitely help steer customers on the right path, help them come up with like requirements type questions to ask of vendors. We can work with you. We have between myself and our VCIOs that are assigned to each and every one of our customers can work with you when you're doing an acquisition of a solution like that to make sure it's going to fit your needs from an operational perspective, a security perspective, and an uptime perspective, price perspective probably as well. And, I think telehealth, telemedicine is a relatively, in the last, 8 years or so, relatively new service. So a lot of the providers that are out there are still fairly immature. There's not a lot of like mature vendors that I think have jumped into that game yet. So that's a very, potentially risk fraught market to be shopping in. So you want to stick with my recommendation to somebody would be sticking with well-known reputable vendors. Don't just go for the latest and greatest that claims to have this brand new feature that nobody else has. Stick to the mature vendors in that space. They're going to give you the best chance of having mature operation, the right kinds of mature security controls. They know what they're doing from a compliance perspective because they've been doing it for X years. That would be my recommendation in that space.
Yeah, that's good advice. So I'd say a couple things to look for. Any messaging feature within the telehealth system needs to be end-to-end encrypted. So that's something to ask for sure. That every telehealth visit has a unique ID for that visit, as opposed to just a unique ID for the provider, so that there's no mistaken crossover between the previous visit and that visit. Another thing to look for, and this speaks to the maturity factor that Andrew mentioned, is that there's a waiting room feature. So too often you'll have a nurse using a doctor's login so they can do the prep work of the patient, what we would call in a clinic rooming the patient, right? Taking medical history, present illness, etc. And then doing the handoff to the doctor using his or her unique credentials. Certainly something we don't want to do. So there are some systems that have a true waiting room feature where the nurse can interact with the patient, or medical assistant can interact with the patient before handing off to the provider. So just a few things to look for there.
Great advice. Thank you both. And we'd like to move on to our final question from Jacob. So, for companies that have geofenced access, what are some good tips for setting up staff with secure overseas access to their accounts? As in someone's on an overseas vacation or a business trip.
Yeah, that's a good question. So one mechanism would be a web proxy, leveraging, an entry point in, if you're geofencing just the United States, have an entry point in the United States. I think for most organizations, that would probably be a little complex to do as a one-off, just because someone's going on vacation, for a week to Mexico or whatever. Another option might be an exception for that particular user for the time frame. Like these geofencing solutions generally have pretty flexible rule sets, and you can create exceptions. So if I knew that Joe was going to Mexico next week, for a family trip, then I would, create a exception on whatever portal we're using, whether it's a VPN or ZTNA access or something like that. There's, almost certainly a way to exempt certain users from that for, hopefully for a limited period of time.
Great. Thank you. That was a good question. Another great answer. So don't see any more questions at this time, but we are going to close this event out. So we have some contact information up here, but I'd like to thank all of you for your time today. I hope you found this discussion to be insightful in your day-to-day endeavors. And I'd like to give a huge thanks to our panelists, Chris, Andrew, and Joe, for taking time out of their schedules to share with us today. So if you're interested in how cyber liability insurance or IT support fits into your risk management strategy, or a few of them that you weren't able to ask today or that come up, we're here to continue. So feel free to contact Chris Conradi at Conradi Insurance, or you can reach out to me at IT Solutions and I will direct your inquiry to the appropriate expert. So after the event, we'll also send a follow-up email with this information, a recording for you to review, and some takeaways from today. And finally, we'd like to show our appreciation for you. So Andrew, panelist and in-house security expert, was kind enough to offer a complimentary security consultation for the first 10 registrants. So stay tuned for an email from me with the sign-up form and more details to have your conversation with Andrew. So thank you again, everyone. Please don't hesitate to reach out, and we really hope you have a great rest of your day.
Thanks for having us, Chris.
Thanks, everyone.
Thanks for
Thank
joining,
you.
everybody.